Bonjour tout le monde. Good morning, everyone. My name is Krista McKee-Sampson, and I am a member of the Board of Directors here at the Ottawa branch of the National Association of Federal Retirees. I would like to begin by recognizing the Ottawa branch is located on the unceded territory of the Algonquin Anishinaabe Nation. We extend our respect to all First Nations, Inuit, and Métis peoples for their valuable past, present, and future contributions to this land and to our country. On behalf of the branch, I am pleased to welcome you to today's webinar called Busting Myths in Skin and Foot Care. I want to give a warm welcome to our presenter, Sarab Dormani. Sarab is a registered nurse and clinic founder of Natural Skin and Soul Wellness. She's here today to separate fact from fiction when it comes to skin and foot health. She'll give us science-backed insight to help keep your skin and feet healthy. Thank you for being with us this morning, Sarah.
Thank you.
I want to give a special welcome to anybody here who is not yet a member of the association. We hope that these webinars will inspire you to join us. And to our members, we hope that these webinars will encourage you to maintain your membership. Veuillez noter que le webinaire sera présenté en anglais, mais la participation bilingue est toujours encouragée. If you have any questions, please type them into the Q&A box, and Sarab will be able to answer them at the end of the session. That's all from me for now, so I'll pass it over to you, Sarab.
Thank you. All right, I'll just share my screen over here. Okay, good. Okay. I think it's working. Great. Good morning, everyone. First off, I would like to thank each and every one of you for joining us today. I also want to thank the association again for having me back. It's always a pleasure to be part of this wonderful community and to be able to have the opportunity to speak about healthy aging. So this morning, we're going to be talking about common myths around skin and foot care, but also how these topics can be clouded by some misinformation. There is so much advice out there from social media to YouTube and even from our dear friends and family, but sometimes it can be hard to separate fact from fiction. So there are countless myths I could be talking about this morning with you, but given the time that we have, I focus on the top 5 most common myths in skin and foot care. And I'm hoping to clear up some confusion and leave you with some practical science-based insights. So just a quick disclaimer, this presentation is designed for educational purposes. Sorry, that's not what I wanted to do. For educational purposes only, providing an overview of selected topics related to skin and foot health. So it's not a substitute for professional medical advice, diagnosis, or treatment, and the information that I'm sharing with you today reflects of my knowledge, experience, education, research, and skills. So for guidance of any specific health concerns, I do recommend to always consult with your primary healthcare provider. So just a quick overview. This morning, we're gonna I always like to introduce myself and my wellness clinic. And then we're going to dive into the epidemic of misinformation that is out there, top 5 myths that I believe that are worth talking about this morning, some key takeaways, and I always like to finish with our exclusive offers to NAFR members. So just before we start, I'd love to introduce myself briefly for those who don't know me. My name is Sarab Dormani, and I'm a registered nurse and co-founder here at Natural Skin and Soul Wellness in Ottawa. I originally started my nursing career in the emergency room, but over time I found myself drawn into the wellness side of healthcare after sustaining a leg injury. So that led me to pursue continuous education in areas like advanced foot care, skin health, facials, laser therapies, lymphedema care, and I've also become a certified compression fitter as well. So today I'm proud to be part of a diverse, holistic, and multidisciplinary team here at Natural Skin and Soul Wellness, where we offer a wide range of services from facials, advanced skincare treatments, laser therapies, medical pedicures, reflexology, massage therapy, you name it. The important thing is really at our clinic, and I think something that I found throughout my nursing career as well, is that we don't believe that self-care is a trend or a luxury. It's really essential for being able to live well, age well, and really feeling your best every day. So just a quick glance of our team here. As you can see, we have a diverse team of medical estheticians, registered nurses, chiropractor, reflexologists, acupuncturists, massage therapists, and our manager that keeps everything together. So before we discuss about the myths, I want to talk about misinformation. So we are living in a time where health and beauty advices are everywhere. The internet, especially social media platforms like Instagram, Facebook, YouTube, are overflowing with tips, tricks, and so-called natural self-care hacks. Some of these trends can be entertaining, but the danger is that a lot of viewers are actually convinced by them. And what you need to know is that online material gets posted without verification. So yes, online material can be helpful and inspirational, but the reality is that there's also a lot of misinformation out there and it spreads very fast. So just some quick statistics. There was a study that was done last year in 2024 that reported that at least 86% of individuals worldwide have been exposed to some kind of fake news online. And more specifically to medical information, the Journal of American Medical Association have found that 70% of online health-related information is false or misleading. So when you look at the numbers, these are still quite high statistics. When you see a post that's going viral, that doesn't necessarily mean that it's safe, effective, or even true. And more importantly, it doesn't mean that the person who is sharing it online is qualified to give advice. Influencers, bloggers will often share what has worked for them when they're sharing something online, but it doesn't always consider everyone else's medical history, their own bodies, their own skin conditions, and other important factors. So it's always important, if you do see something online that is piquing your interest, it's important to cross-reference it with trusted professionals, people who are trained, certified, and that do work with evidence-based practices. And even in healthcare, it is important to verify that your information is reliable. So if you look at myself, yes, I'm a registered nurse, but I'm here today to talk to you about topics that are within my knowledge, my clinical experience, and my scope of practice. I'm not here to give you advice this morning about nutrition or how to manage your heart and kidney conditions, because those are topics that are outside of my professional expertise. So it's not because I'm a nurse that I know everything about health either. So a couple of things to kind of look for. So it's always important to check your sources, but it's also important to make sure that the information you're receiving comes from qualified, credible professionals in their appropriate field. So just quickly, how can you spot bad advice? So when it comes to health and beauty advice, especially online, maybe take a step back and think critically before jumping in. So first off, you can ask yourself, again, who is sharing this advice? Is it a licensed professional that's sharing information in their area of expertise, or are they just someone with a lot of followers, views, and likes? And then after that, you can ask yourself, well, where is the scientific evidence? Because real evidence should be backed by credible research, clinical studies, and professional guidelines, because that is the content that gets verified before it gets published. It's not just a, oh, will this work for me kind of story. You also have to look at the motivation behind the message. So if the advice comes with a sales pitch, that's always a red flag for me. You'll see something online saying, oh my God, you need to buy this miracle product. My wrinkles, they disappeared after 2 applications, and here's a link to buy my product. So I would just say, okay, back up, because let's just review the science behind this claim. So someone who claims that a moisturizer erased the wrinkles, well, you have to tell yourself, okay, well, moisturizers primarily work on the epidermis, which is the outermost layer of your skin. And wrinkles actually form a lot deeper than the epidermis. They form into the dermis and even into the underlying muscles. So If that was true, we would want to more use technologies, energy-based treatments to be able to target the deeper layers. So something like radio frequency that stimulates collagen production at the right depth to be able to help with the skin's elasticity and texture to be able to reduce some of those fine lines and wrinkles rather than just depending on a moisturizer. And finally, I would say always trust your instincts. If it's too good to be true. So I can tell you on my professional experience, quick fixes and overnight miracles, they simply do not exist, especially when it comes to skincare, foot care, and wellness. Real results do take time because if results didn't take time, then everything out there would have a miracle solution and it would be easily ordered on Amazon Prime. And medical clinics and hospitals and wellness centers and professionals like me would not exist. All right, so let's start with our myths today that are worth talking about. So first myth is one of the biggest myths that I do hear all the time is that the idea of natural products are automatically safer and better for your skin. So there is a belief out there that if something is labeled natural and organic, it must be non-toxic, super safe, and instantly effective. And unfortunately, that is not always the case. The reality is that natural ingredients can still cause irritation, allergic reactions, and even introduce toxins. So here's a little example, maybe a bit on the extreme, but it's just to give you a very quick visual. If you think about poison ivy, it's 100% natural, it's 100% organic, but I wouldn't recommend you rubbing it on your skin. So it's also important to understand that the term organic simply refers to how the ingredients have been farmed, so meaning that they've been farmed without pesticides. But it doesn't automatically mean that they deliver better skin results or that they are the right treatment for every skin concern. So for example, if you see a product with a label that says organic coconut oil, it sounds absolutely amazing. But what you need to tell yourself is that coconut oil is an ingredient that contains large molecules that can actually clog in pores. So therefore, it can be a nightmare to use for someone who has oily skin, who has acne-prone skin, because they will break out. And I can tell you that I've had people report that to me. Oh, I've applied coconut oil on my face and my face is like full of acne. It makes sense. The other thing you also have to know is that real skin regeneration and repair is a slow biological process. This is a process that can take weeks and often months. Again, overnight solutions, overnight miracles do not exist, okay? We're not superheroes on the big screen with powerful mutating DNAs, because if that was the case, every cut, every scrape that we would have on our skin would heal overnight. And we wouldn't have to worry about wounds, lesions, and other skin issues. So there is no such thing as an instant fix, whether it's a natural product or a lab formulated product. Sorry. All right. So natural skincare, yes, it sounds appealing and it can still offer good results. But the other thing you also have to tell yourself that in the skincare industry, the term natural and clean are not regulated terms by Health Canada. So anyone can use these words for marketing purposes because it just simply sounds amazing. So as we mentioned before, some natural ingredients can be harmful or irritating on certain skin types. So if you look at something like peppermint oil, it can cause strong irritations and sensitivity because it's, an oil that's known to be hot. Something like tea tree oil is a very drying oil as well. So if you put it on dry skin, it's only going to make it worse. Citrus oil can make you more prone to sunburns. So just a few examples. Another thing to also keep in mind is that natural products often have a shorter shelf life, given that they don't have any preservative. So they can make them more prone to developing mold and bacterial growth if they're not stored in properly. So for example, I wouldn't recommend you leaving a natural made body scrub in the shower because of the humidity. You will have mold growing into it. The other thing to know is that if a product is organic, again, it sounds great, it's amazing, there's no pesticides, but it can still be poorly formulated for the skin, meaning that it can still have not the proper combination of products, or like using too many harsh oils together. So let's say if you do get a product that has a mix of citrus oil and peppermint oil, it probably smells amazing, but it can be quite irritating for the skin. So on the other hand, synthetic skincare ingredients like peptides, hyaluronic acid, and ceramides, which we're going to talk a bit later, are more carefully engineered to be stable, effective for treating more advanced skin concerns such as aging, pigmentation, dehydration. And again, these are ingredients that have undergone more scientific research and that need to also go through third-party testings. So natural products, unfortunately, don't have as much of those regulation standards. So the bottom line is, yes, natural can be wonderful. I'm not saying don't do natural. What I'm saying is it still needs to be chosen carefully, and make sure you always read your label, and that the ingredients that are on the label are tailored to your specific skincare needs. So talking about moisturizers, another common myth that I hear all the time is that only dry skin needs moisturizers. And again, that's simply not true. Many people believe that if they have oily skin, they don't need to moisturize, or that the more expensive a product is, the better it must be. And other things that other people do think that thick and heavy creams are automatically, they mean more deeper hydration. I'll have patients coming in and they're going to say, oh my God, give me the thickest cream you have, either for their face or for their feet. I want to feel the cream on my skin. And sometimes I'm like, okay, let's do a little reality check, because that's not always how it works. And the other myth that I always hear is that moisturizing is just to keep the skin pretty and youthful. But the reality is that first of all skin types need hydration, whether your skin is dry, oily, sensitive. And when you go into professional skincare lines, you will see products that are carefully curated for specific skincare concerns. Moisturizers help maintain your skin barrier, which is what's protecting you from irritation, dehydration, and also environmental damage. And what really, really matters is the ingredients inside the products, which we'll talk about at the next slide. But what you also need to know is that the most expensive cream out there doesn't mean it's better, but quality ingredients do cost more. So a good moisturizer isn't necessarily about the brand, but rather the science behind the formula. So if you take, for example, an ingredient called peptides, which is a protein that helps with collagen stimulation, well, that is going to cost more if it's in a moisturizer versus a basic lotion that just has an ingredient like aloe vera. It's also important to know that the thicker the cream, yes, it might feel rich and amazing, but sometimes if it's too thick, the molecules are not small enough to penetrate into the skin cells, and it can just sit on top of the skin. Again, what's really important is making sure that the moisturizer has the proper formulation with active ingredients and molecules that can penetrate in the deeper skin layers and work more at a cellular level. And I obviously don't think that moisturizer or moisturizing your skin is about chasing youth or looking pretty. It's about really maintaining your skin's health and strength, because your skin is your body's largest organ. It plays a lot of important roles. And why wouldn't you want to take care of it with quality products? So with the facts being, moisturizing daily is one of the most important habits out there, really, for preventing and protecting your skin. We do have to understand that as we age, our skin does naturally change. Because of hormonal changes, we produce less natural skin oils, which means that the skin can't naturally lock in moisture as easily. The skin barrier becomes thinner, making it more fragile and more sensitive. The skin takes longer to renew and heal. And so this is why it's important to have a well-formulated moisturizer. And when you are choosing a moisturizer, I typically recommend looking for different key ingredients. Now, again, this is personal to each one of us, but just some basic ones out there. An ingredient like hyaluronic acid. Hyaluronic acid is also a molecule that as we age, we produce less of. So it can easily be found in some quality moisturizers. It acts like a sponge. It holds the water inside the skin, and it gives it more of that natural hydration and more of that plumping feeling into your skin. Ceramides are a natural lipid, which is a fat that helps strengthen and repair the skin barrier. So often when we think of moisturizer, we think just of hydration, but it's also important to think of it as being a skin barrier that you want to strengthen. Peptides is another one of my favorite because as we age, we produce less collagen as well. And peptides is a small protein that helps stimulate collagen production and helps improve your skin's resilience. The other thing also too important is that different area of your body will need different kind of moisturizer because the skin is different from your face to your feet as well. So, and then just to finish off the slide on moisturizing, what I do recommend is just know that moisturizing regularly, it helps strengthen your skin. It helps prevent damage before it actually starts. We see a lot of patients coming into the clinic with either cracked skin, cracked heels on their feet, or dry skin on their face, on their cheeks with a lot of sensitivity. And a lot of this could have been prevented with regular and effective moisturizing because, again, it's not just a beauty step. It's really a fundamental part of protecting and taking care of your skin. So after you apply your moisturizer, it's important to apply your sunscreen, which brings me to our next myth. So what I hear again is that a lot of people think that sunscreen is for the beach days and the summer vacation. And that is also something I believed as well before going into learning more about skincare. And it's really a huge myth because the reality is that UV rays are present all year round, even on cloudy, rainy, and snowy days, unfortunately. Studies have shown that up to 80% of UV rays can reach your skin through the clouds. So they do penetrate through the clouds. They can penetrate through a window. So you are exposed to UV rays when you are driving into your car, sitting by a window, you're walking outside, even when it's gray out there. Another common myth is that a lot of people believe that so the darker your skin tone, you don't necessarily need sunscreen, or if you're tanned, you don't need sunscreen. So while people with darker skin tones do have more melanin, which is our natural pigmentation in our skin, hair, eyes, that gives them that natural color. It does offer a bit of protection, but it doesn't make you immune to sun damage. So you are still at risk of hyperpigmentation, premature aging, and increased risk of skin cancer. I often have people being tan that are like, oh no, I don't need sunscreen. I have a natural tan. I'm fine. That's not what's going to protect you from the sun's UV rays. Another thing also to remember is that when it comes to sunscreen application, applying some just in the morning is not enough. It's really ideal to apply it every 2 hours, whether it's an SPF 30 or an SPF 50. But reapplication should be done more often if you are sweating, if you are swimming as well. So when it comes to sunscreen, the rule is simple. If you see daylight, start thinking sun protection. As I mentioned before, UV rays are still reaching your skin even during the cloudy days. And clouds typically will block more sunlight, but they do not block UV rays. Just a quick example, UVA rays are the sneaky ones because they don't cause sunburns like UVB rays. So they actually do penetrate deeper into the skin because we don't feel that sunburn effect from it as much. They break down your collagen. They lead to premature aging, hyperpigmentation, and they can cause DNA mutation, which is what's going to increase the risk of developing skin cancer, such as melanoma. What we know today is that SPF is not just about the beach. It's really about protection and prevention every single day. And without daily sunscreen, people of all skin tones, and yes, even the deeper, darker skin tones, are at risk of skin damage and skin cancer. I see a lot of my patients coming in, and a lot of them will admit that, oh, we come from a time where we didn't believe in applying sunscreen or reapplying sunscreen, and they often have lesions removed, cancerous lesions from their face, from their back, even on their legs. And which brings me to the important thing is that when you are applying sunscreen, it's really important to cover all exposed area. So not just your face, but your hands, your arms, your chest, your legs, wherever area is exposed, and even your ears. I was listening to a podcast from a dermatologist a while back that was saying that they're seeing more and more skin cancer developing on the ears because people forget to put sunscreen on their ears. So key takeaway from this is that daily sunscreen use is really one of the easiest, most powerful step you can take to protecting your skin's health appearance. And really by reducing not only visible signs of premature aging, but also protecting your skin from skin cancer. So speaking about protection and prevention, it's not just our skin that needs attention, but also our nails and especially our toenails that are often vulnerable to issues that are overlooked. So I'm going to shift the gear a bit here and talk about foot health and concerns. So one of the most common problems that we do see at our clinic is actually fungal infections to the toenails. And one of the biggest myths is that often a lot of people think that nail fungus is just a cosmetic concern and it's just about appearance, but that is not true. Nail fungus is an infection that is contagious. It causes pain, discomfort, and even serious mobility issues. It can spread, and anyone can get nail fungus. It doesn't mean you have poor foot hygiene. We see nail fungus in a variety of patients at the clinic, especially if you've walked and high-risk areas such as like public pools, gyms, spas, locker rooms, showers, and so on. And it can also spread in the same household as well. So when we are doing fungal toenail treatments, we're often going to do spouses because it does spread from partners to partners. And again, people think that if there's no pain, there's no problem. But the truth is that fungal infections will often start painless, but they are progressive. So meaning that the longer they're ignored, the deeper they are going to get, the more stubborn they become. And the reality is that they do not go away on their own. Over-the-counter creams that are out there at the pharmacy, they're just not enough to cure fungal toenails because the fungus lies under the nail bed and through all of the layers of the nail. So just think of an onion that you're peeling layer after layer, and there's always a surprise between every layer. And topical treatments that are over the counter just don't reach that deep. So I believe that, yes, okay, over the counter products at the pharmacy are great to provide temporary relief. However, I don't believe that it's really the instant cure for certain complex cases like this. And there's a reason why when you buy an over-the-counter product like that, and you read the label, it's often going to say, oh, if you don't see improvement after 2 weeks, please discontinue and consult a healthcare professional. And that's because medical concerns often do require medical professionals that can offer treatments that can only be offered in clinics. And we'll talk about the different treatments at the next slide. The other thing too is I'll often have patients saying, oh, well, trim the toenail as much as you can, or like, let's pull out the toenail. I just want to get rid of it. Unfortunately, it doesn't remove the fungus because, as I mentioned, it often lives in the nail bed as well, which is the skin of the nail. And this is why early diagnosis and prevention is really key to protecting yourself and from the fungus to be spreading. So again, coming back is to know that, okay, well, nail fungus is a living infection. If it's left untreated, it will continue to spread and worse over time. Yes, we see them in young adults, but they are also very common in older adults for a few reasons. One being is that the circulation does decrease, especially in your feet. And our feet are already not prone to really great circulation because they're the furthest body part from the heart. So, and as we age, that circulation also decreases, the immune system weakens, and it just makes it harder for the body to fight infections. It's also more common in patients with diabetes and athlete's foot and other autoimmune conditions because they will have more compromised skin and nail health. So something as simple as a minor skin injury around the nail from a stubbed toe to tight shoes can create an entry point for the fungus to penetrate and start living on your toenails rent-free. And we don't like that. So as I mentioned, environmental factors also matter. So if you do go to the gym very often, if you do go to pools or a lot of different spas or public showers, those are just the common places that fungal infections can spread very easily because fungus thrives in dark, warm, moist environments. And unfortunately, that is also what our feet are subject to. So just think the inside of your shoes. Early signs or most signs include that the nail is starting to get thick, yellow, brown, crumbly, and often we're going to notice like also foul smell to it. And as the infection progresses, it can become more painful and ingrown, spreading the infection to the surrounding skin, to the other toenails. I also see sometimes patients having the fungus down the line starting to spread to their fingernails because they touch their feet with their hands. And that's definitely a concern for us at the clinic. And I just want to kind of share a little story with you because I had this one patient coming in once saying that their doctor didn't want to treat their nail fungus because he directly told the patient, well, if you're not going to become a foot model, don't bother. And I think that statement is wrong on so many levels because, again, fungus is not cosmetic. It can spread, it can lead to other foot-related complications, and it does get worse. And if you have an ingrown toenail that has a fungal infection and now has a bacterial infection, you're just adding more and more layers of complication and more treatments down the line. And it could have been prevented had we started interventions a lot earlier. And again, when it comes to over-the-counter medication out there, once the infection is established, it can be a lot more difficult to treat because the fungus is quite stubborn. And the other thing you also have to tell yourself is that toenails don't grow very fast, and that's why these treatments can often also take time. But we do know that combination treatments are just a lot more effective because they attack the infection from different angles. So a couple of options that are out there, one of them being there are prescription oral antifungal medication that help to fight the infection through the bloodstream. But that is definitely something you need to speak to one of your prescriber, like either your doctor, nurse practitioner. It's not always the first line of choice because there are some side effects on the liver, and people that do have to take the oral medication do have to do routine blood work on their liver as well to make sure that there hasn't been any liver damage. So it's not typically the first line of choice for prescriptions, but it's still out there. We see prescribed a lot for our patients is the medical grade topical treatments because they don't have any downtime. You apply it directly on the toenail and there's like really no side effects. But the other thing is that it just sits on top of the nail and it doesn't always penetrate through. Laser therapies and phototherapies, they're great because they help disrupt and destroy the fungal cells deep where the nail is and where the creams and other products can't reach. And an absolute must for any treatment that you do, whether it's topical or laser, you absolutely need to combine it with routine medical foot care, which includes debriding your nail. So this is like a little podiatric drill that we take and we start thinning the toenail safely to remove all of the infected part of the nail. So whatever treatment you do, it actually allows these therapies to reach into the deeper layer of the nails rather than just sitting on top of the toenail. So what we've seen more on a success rate is that using combination therapies together, we can really maximize the chances of destroying the fungal infection, reducing the risk of reoccurrence because reoccurrences do happen if we stop treatments too soon. And the sooner we address it, the easier it is to treat and prevent it from spreading. So now that we've talked about nail health, I want to stay focused on the foundation of our bodies, which is our feet. And just like fungal infections are often brushed off as not being a big deal, foot pain is another thing that people tend to ignore and unfortunately accept as a normal part of aging. But the truth is that persistent foot pain is not something you should be living with. So we're going to dive into our final myth here. And basically, a lot of people think that foot pain is just a normal part of getting older, or they think that any pain is a normal part of aging, and that you just have to tough it out. And I see and hear that a lot in my practice. And honestly, it makes me sad because untreated pain can actually have serious long-term consequences on us. So the reality is that pain is a way for your body to tell you that something is wrong. And persistent pain or any pain isn't normal. It's actually a signal your body's trying to talk to you. It's asking you to give it some attention. And yes, our bodies are great at adapting to pain and compensating, but if we overuse that, adaptation quality that our body has, without really addressing the underlying issue, we can end up with bigger problems, unfortunately. So if you have pain on your left foot and you start compensating on your right foot, you can start altering your gait and your walking pattern. You can be putting more strain and more pressure on the opposite side of your body. So starting to have more knee pain, hip pain, back pain, even neck pain. And it can also increase your risk of having falls. I often see patients wanting a quick fix. They just want to purchase an over-the-counter insole at the pharmacy, or they're thinking that they're just going to bed rest without addressing the underlying cause of their pain. So these are options that offer some temporary relief, but not really a long-term solution. And it's important to have your pain addressed, diagnosed, and look for targeted treatment that actually address the real cause. So examples can be, having medical interventions that need a diagnosis, depending on what's going on. If you might need an X-ray to see what's going on, a more in-depth assessment, you might need manual therapies, custom orthotics, strengthening exercise, or medical foot care as well. So again, pain is not just a part of life, it is a warning signal, and your body is basically telling you that it needs attention. And there can be different underlying causes of foot pain, your feet being quite complex. It can be arthritis, bunions, plantar fasciitis, concerns that are affecting the bones, the joints, the ligaments in your feet. It can be nerve issues. It can be circulatory issues in your legs, poor circulation, vascular issues, or edema, swelling. It can be other foot concerns like having horns, calluses, ingrown toenails, or even plantar warts that can be quite painful, or fungal toenails like we just talked about, or more serious concerns that need urgent attention, such as infections, wounds, ulcers, especially in our high-risk population like our diabetics. So again, ignoring pain doesn't make it go away. It can often lead to, decreased physical activity because it's too painful to walk or to do anything. And we know that that can affect our overall health, which can often enough lead to loss of balance and mobility issues and increase our risk of falls. It can also delay treatment options, and it could have been treated a lot better had it been caught easier. And that unfortunately can lead down the line to higher healthcare costs and more invasive treatments. So that's why, as a nurse, I will tell you, don't always go on Dr. Google to diagnose yourself. Consult a qualified professional who can accurately assess and start treating the root cause of your pain. Routine checkups are great. Early interventions are even better. You're basically protecting your mobility, your independence, and your quality of life. Because at the end of the day, pain is not something we should accept, but rather address. So that summarizes our top 5 myths that I wanted to share with you this morning. But as we wrapped up today, I did wanted to share with you some key messages that I really want you to take away this morning. So first off, remember that prevention is powerful at any age, no matter where you are in your health and wellness journey. Protecting your skin, your feet, and your overall wellness is a lot more easier and effective to do than treating a major problem later. And it's never too late to start. Second, I think I've said this enough: when you do your research, just always verify your sources. Ask yourself, are they credible? Or is it backed up by science? Are they healthcare professional? Or is it just internet opinions and whoever published it is looking for views and popularity? So the quality of the information matters as much as the treatment that you choose. It's also important to know, third off, that any changes in your body, any visible changes, any pain, anything that just feels off is a warning sign and not a normal part of aging. So don't ignore it. And again, early interventions can save you a lot of discomfort, time, and money down the road. And don't wait for things to get bad to check in with your healthcare professionals. Routine checkups, even when you feel fine, are a critical part of protecting your health and wellness. We see a lot of patients at our clinic that did start with having, either health or skin concerns, but that they just now come in for routine checkups because they want to keep their feet healthy. They want to keep their skin healthy. And just like you do it with your eyes and teeth, you don't wait to have your vision, change, or you don't wait to have unbearable tooth pain to get things checked out or get assessed. So same thing with your skin and your feet. And the biggest takeaway would be that healthy aging isn't about chasing perfection or, trying to, I'll never tell my patients, oh, let's, knock off 20 years off of your age. That's not true. It's not about perfection. It's about smart protection. So it's really about making informed choices, taking preventative actions, and supporting your body to be able to age in a healthy way. All right. So with that being said, now that we've debunked some myths and we talked about how important it is to prevent and protect and provide yourself with self-care at every age, I want to share something really, really exciting with our members that we've put exclusively together for you. So to really support your wellness journey, we are offering our VIP membership that is packed with all of the amazing benefits here on screen today. So our membership is typically $375 a year, but with your NAFR membership, you get a 45% discount off of your membership fee. And this membership offer also comes in with a free hydrofacial that is valued at $200 alone. So you get that for free for only $206 for the year, on top of all the other exclusive perks that you have here on screen. And with that being said, and I think we're going to send a link after that in a follow-up email. I wanted to also bring back a other offer that we had at our past webinar, because once this offer was expired, we've had people emailing us afterwards saying that they weren't able to take advantage of it back then. So I figured, why not offer it again today to our members, and to also thank you for joining us today. So if you're curious about your skin and wellness, and we also invite you to come and see us in person, and no need to be shy. We're an amazing, supportive team. So as a special thank you, we are offering you a free medical aesthetics consultation valued at $50, no obligation. It's just really an opportunity for you to meet our skincare professionals and discuss about your goals and explore possible options that can fit your skin and wellness needs. And I also wanted to add something else, basically answer a question probably prior to being asked, because I get this question also asked a lot in follow-up emails. So while we are quite excited to offer all of these promotions to you, I do want to mention that some of our regulated health services at the clinic, such as our medical foot care, with our nurses or our acupuncture services with for pain management, we are not allowed to discount those services under our colleges and under healthcare regulations. So I am simply not allowed to give you a coupon or a discount for these services. But if you do have private insurance plan, often you can submit these services and receive up to 80% reimbursement depending on your plan. And a 80% reimbursement is probably better than any deal or discount that I could ever offer you. So I would say if you do have private healthcare benefits, it's definitely worth checking and a great option to taking care of yourself with that. All right, so as we wrap up, I want to thank everyone today. I hope you are walking away with a few new insights, a little more confidence about how to take smart, proactive steps in your skin, foot, and overall wellness journey. If you like to connect with us or you want to book in your complimentary consultation, learn more about our services, this is all of our information on screen here. We'll be starting Q&A shortly, but if ever your question doesn't get picked this morning, I invite you to send us an email here at info@naturalwellness.ca. And I always love connecting with each and every one of you after these presentations. And we're very happy to support you. Thank you.
Thank you very much, Sarah. That was very informative. And full disclosure, I became a client of Sarab's clinic myself. I have benefited from many of her services, and the medical pedicures have been incredible for me. They've made a huge difference. So with that, there's a few questions to address, and a couple of them have addressed the coverage. And so from personal experience, I can say that that yes, my medical pedicures have been covered under the public service healthcare plan with Canada Life at 80%, but there is a maximum per capita per calendar year of $500. So up to that point, it's you're good with your public health care service. And I have not submitted a prescription, and from looking quickly at the plan, no prescription is required for the medical pedicures. So just to let you know and to answer those questions. But of course, Sarab, if you have anything else to add to that, please do.
No, and I think you, well, thank you for sharing your own experience at the clinic. Obviously, I can't say who my patients are, but you guys are always, you're always, I definitely appreciate your feedback and your support. And it's great to hear that we've been able to help you in your health and wellness journey.
Absolutely. Okay, over to other questions. So firstly, starting with a supportive comment from an attendee today saying, supporting what you've already said, that organic does not mean no pesticides necessarily. There's all kinds of organic pesticides. And again, organic natural pesticides can be more toxic than synthetic pesticides and must be treated carefully. I don't know the expertise of this person, but of course, that's a comment to treat that
Yeah,
information
great.
with
Thank
care.
you.
Next question: is there a trusted website that lists the best moisturizers?
Um, like I'm no per se, because I feel like every website out there is there's always a little bit of marketing behind it. You know, these are websites that are going to be like, oh, you know, they're going to make it sound like their product is absolutely amazing, and then here's a link to purchase. So you always have to be careful with that in terms of what is out there in terms of moisturizers or any really product that you're not sure of is always consult and have a guided professional to kind of help you make the best decision out there, because what works for me might not work for you either. And it can be tricky to self-diagnose. And if I just give you a quick example about myself, you know, I do take some natural supplements myself, but I do it with guidance of a naturopathic doctor, because there is just so much information out there. And if I read all the information, I'm going to think that I need everything. And in reality, I don't. So Even myself as a nurse, I have my own trusted healthcare professionals that kind of help me make these decisions.
Excellent. So kind of following on to that, a couple questions about SPF. So
Yeah.
I'll combine them because I think you can answer them together. What about like kind of recommendations for the best SPF and sunscreen to buy? And the follow-up to that by another attendee, if you wear a hat, do you still have to apply sunscreen every 2 hours?
So I would say you would at least have to apply sunscreen on the areas that are not exposed with your hat. So if you're wearing a t-shirt, then you would have to obviously apply it on your arms and so on. It always depends the material of your hat. So like, let's say if it's made of like straw and the rays can kind of go through. So a couple of little factors to consider. But again, it's not bad to do so. Like I said, sometimes you'll have to reapply it more often if you are sweating because the sunscreen SPF is also going to wear off as well. The best site to buy SPF and sunscreen, again, always like, again, do your research. And I'm not here to be biased, or I don't like to say, oh, well, this is how we do it at the clinic, but I can tell you that our clinic, the SPF brand that we carry has been approved by Health Canada. So there's a DIN number on it on the classic SPF and an NPN number on the mineral SPF. So we know that these are products that have been approved by Health Canada, and to be approved by Health Canada, your product has to be backed up by science as well. So if that can maybe be a bit of an indication, that would be my recommendation. Because basically the SPF has been treated like a pharmaceutical product when it has a DIN number on it.
Okay, thank you. So back again to the medical pedicure area, the debridement treatment, is it covered under the public service healthcare benefit plan? For myself personally, I can say yes, it has been covered at 80% to the maximum limit of 500 per calendar year. And then kind of continuing on in the foot care area, years of ill-fitting shoes has caused corns, calluses, etc. Does the medical pedicure address this?
Yes, so when you book a medical foot care service at our clinic, you're always seen by one of our RNs, our registered nurses. So he's going to come in for the first appointment is booked as an initial consultation and treatment. So you have the assessment with the nurse, and after that, we'll address your concerns. We'll be able to provide you treatment during your first appointment. And then after that, talk about a treatment plan, like how often you would need to come and see us to kind of keep everything under control. Are there product recommendations we can make for you to just not having to go through the same issues again afterwards?
And along that line, what are the best methods for dealing with cracked feet and callous feet?
So cracked heels, calluses are caused by different factors. So specifically with skin cracks, it can be caused by lack of hydration to the feet, but also pressure to the feet. So those are things that, again, when we see you in clinic, we're able to see, is it just a pressure problem or it's also a skin dehydration problem to your feet? And we'd be able to remove very gently, and it's a painless procedure in clinic, those dry skin buildups. So the kind of debridement we do on the nails, we do it on the skin, but again, very, very gentle and painless, because I can recommend for you to apply a moisturizer at home, but if you have too much thick layers of skin, the moisturizer is not going to penetrate in. And moisturizers and cream for them to work, they need to interact with live skin cells. And when the skin is too dry, callous, and cracked, there's a lot of dead skin cells. So we just need to gently remove those layers and then get you on top of a regimen. If the issue is friction and pressure, we'd be addressing your shoes. Maybe you need a wider shoe. Maybe you need some type of like custom orthotic or some support in your shoe to be able to support the feet better.
Just on that then too, if I understand correctly, Sarab, your clinic also does compression of stockings, fittings, and orthotics as well. Is that correct?
Yes, yes, we do that as well. So those are additional services that we offer at our clinic.
Excellent. So we had one more question on the toe fungus subject about Jublia as a prescription. There's been conflicting medical kind of opinions on that, and they're just looking to understand more what your opinion on Jublia is.
Okay, I think I see the question. They said the podiatrist told me it was useless and doesn't work for more people. My opinion, well, I'm not going to give full-blown pharmaceutical opinions here on the website. So I don't have big pharma after me. But what I can tell you is coming back to combination treatments are really, really important. So Jublia alone is just going to sit on top of the nails. And we know that fungus causes this nail to be thick as well. And often the fungus can be on the underlying surface of the nail. So the Jublia just wouldn't penetrate. And that's why the combination of that mechanical debridement is really, really necessary. So we remove those layers of infection and we allow your medication to penetrate deeper. And we do see people at the clinic that just do the Jublia and the routine medical foot care. And we also do offer the phototherapy. So we do have some people that add on the phototherapy. It just comes in at what people want to do. You know, there's some financial cost associated to that. There's some choices as well. And there's also commitment to these treatments. So when you want to do phototherapy, you do have to tell yourself, okay, well, these are treatments that I have to come in every 3 weeks to do. So it comes down to a personal choice.
Excellent.
Mhm.
Okay, a couple questions about the clinic, where you're located, and can you accommodate someone who requires a fragrance-free environment?
So located at 1677 Carling Avenue. The address is right here, just between Cole and Churchill. So just at the outline of Westboro. We're across the old Canadian Tire that just became the big gym right now. To accommodate someone who requires a fragrance-free environment. If you are interested in booking, I would just either you book online or in clinic, just mention it to us. We do have some like foot care creams that do have a mild fragrance, like a mint or a eucalyptus scent to them. And we also have products that are fragrance-free. So if we know ahead of time, then we know which products to use. But most of our products for the feet are unscented. And if ever it's for skincare, we do also have lines of skincare products that are unscented as well for more sensitive skins. So there are some options. It's not exclusive per se, but we can definitely accommodate.
Okay. And the final question we have at the moment is, what is edema? Oh, one more after
Oh,
that.
no, that's okay. So edema basically means a swelling, so fluid retention. Now, I spoke a bit more specifically about edema in the legs, but I mean, you can have it also in your arms and your fingers, but yeah, it's basically fluid retention. So then there can be some underlying issues to that, a bit more complex, but is it your heart that's not pumping blood properly? And then there's more fluid accumulation into your legs. Is it your kidneys? Is it your lymphatic system that is not draining properly? So a couple of things.
Okay. And then, sorry, the final kind of request for advice. I just finished 6 laser treatments for nail fungus over 2 years on one large toe. It has helped, but has not cured the problem. I use Jublia daily. Is there any other advice?
So again, just right off the bat without assessing, I would say probably repeat a toenail culture. Ask your physician if you can repeat a toenail culture to see if there is still any uh, sort of microscopically, if there is still any evidence of fungus living on the nail, because often with nail fungus, you know, if it's been there for quite some time, it will start changing the structure of the nail. So the nail can be cured, but that it just doesn't look like the way it used to, depending on how long it's been there, because it's sort of, like I said, started changing the structure of the toenail. With that being said, think of it like causing sort of a scar tissue. but on your nail. So we do see patients that their nail fungus is gone, but sometimes the toenail is going to be a bit thicker and slightly a bit discolored, but it's not brittle anymore. It's not crumbling. It's growing clear. It just looks a bit different. So at that point, when in doubt, we repeat a nail culture to see if it's still there. And I do believe that if you want to repeat a nail culture, you might have to discontinue your Jublia for a few days prior to the nail culture so it doesn't alter the results.
Okay. That's the end of our questions today. And we're up to our time limit. So thank you very much for your participation in today's webinar. A big thank you, Sarah, for your great presentation this morning. Please look out for our follow-up email. That'll contain a recording for today's session, as well as more information on natural skin and soul wellness, including Sarab's kind offers. Remember that you can invite non-members to attend our webinars and to try us out as a guest. To register for our upcoming webinars, please visit the Ottawa branch website at nafrottawa.com. Sarah, do you have any final parting comments?
This was absolutely great. I want to thank the association again for having me. I think we were talking about this earlier. This is like my 9th webinar with you, with the association. So it's always a pleasure to come in. Thank you all for participating and the great questions there. I also get to learn from your question because I also see what people are more intrigued about or concerned about. So it kind of helps me gauge probably my next topics as well. And again, if you have any further questions, I do invite you to send us an email. I always love connecting with you guys afterwards as well. So thank you again for this morning.
Okay. Thanks, everyone, and take care. We'll see you at our next webinar.
Bye.